Hi, my name is Dr Joan St John. I'm a GP with special interest in diabetes working in Northwest London. I'm co-author of Carbs and Cow's World Foods book and also Diabetes UK clinical champion. In 2021, I was privileged enough to work with Abalone Trust on a series of events called Know Your Numbers. And I'm going to give you a flavour of a distilled version of what I spoke about in that series of events. So I'm going to give you two figures that I think it's really important that you know about, but also some other information, and particularly some information about what you can do if you're at risk of developing type 2 diabetes or if you're living with diabetes. But first of all, before we do that, let's talk about what is diabetes. If you eat or drink something that contains starch or sugar, and your starch might look like a carbohydrate like potatoes, pasta, rice, bread, but it might look like things like chapatis, yam, cassava, plantain, or other starchy carbohydrates like that. If you eat something like that, the carbohydrate goes into your stomach and it's broken down into what was called glucose. Now, some people would call that sugar, but I'd like to continue calling it glucose so there's no confusion. That glucose goes into your bloodstream where it's met by a hormone called insulin. The insulin is produced by an organ called the pancreas in your body, and normally there's sufficient insulin produced to keep your blood glucose level at a normal level. But if that organ is not working properly, if it's not producing enough insulin or the insulin it produces doesn't work properly, then you can get a buildup of glucose in the blood. What happens? Your body, which is amazing, tries to get rid of this excess glucose. And so you'll find that you're going to the toilet more often, passing urine more often, because your body's trying to get rid of the excess glucose. But it can also cause other symptoms. So it can make you feel really tired. With some people, it can make them lose weight, or you certainly can feel very thirsty. Just to point out, there's two main types of diabetes. Type 1, in which, remember that insulin hormone? There is no insulin hormone being produced. And so for treatment, it is really vital that you have insulin treatment alongside other things that you may need. Type 2 diabetes is different. Both, remember, have that raised blood glucose, but with type 2 diabetes, it's a mixture of factors that can put you at risk of developing this. So things like your age, your ethnicity, your family history can put you at risk. More about that later. And if you combine that with things like other medical conditions, then that can increase your risk of developing type 2 diabetes. It can be treated in a variety of ways. So I spoke about blood glucose levels. The first number that I want to point out to you is the HbA1c. Now, this is expressed as a number, and I've put on here in a sort of traffic light way, green, amber, and red for the numbers that you need to know where everything's okay. Everything's maybe a little bit, you need to keep an eye on it, or you may have type 2 diabetes or some other form of diabetes. Let me just explain a bit about the HbA1c. HbA1c is the amount of glucose that is stuck to your red blood cells and is over the previous 3 months. So unlike the finger prick test that you might do, which will show you what your blood glucose is here and now at this moment, the HbA1c is looking back over 3 months and giving you like an average reading. So if that average reading is below 42 millimoles per mole, everything seems to be fine at this time. If it's somewhere between 42 and 47, it means that you're at risk of developing what's likely to be type 2 diabetes, and that's where you need to do something about it. If it's above 48 or 48 millimoles per mole, then that's what we would normally use to diagnose you with type 2 diabetes. But what I'd like to say is that each person is an individual, so these figures would need to be discussed with your healthcare professional, because we have to be sure that this is the correct diagnosis for you. And so please do discuss that with your healthcare professional. So let's say it's 48 millimoles per mole. What does it matter if you have diabetes? Well, it matters because it can open the door to what we call complications. And if you start at the top of your head with your brain, right down to the tips of your toes, unfortunately, if you have diabetes, that can increase your chances of developing complications in the heart, in the kidneys, in the eyes, in the feet, as well as all of the other complications that you can see on this diagram here. So what can we do about it? Because remember I said two main figures. I've given you one, which is the HbA1c. Here's the second one. Simple thing that you can do to see if you're at risk of developing type 2 diabetes, because prevention is always better than cure. So if you know that you're at risk, perhaps you can do something about it. So if you're a man and your waist circumference is 94 centimeters, it puts you at increased risk of what we call cardiovascular conditions or type 2 diabetes. Now, if it's 102 centimeters or more, then your risk is greatly increases. Your chances of developing type 2 diabetes are greatly increased. For a woman, 80 centimeters increased risk, 88 centimeters greatly increased risk. So something very easy that you could possibly do today to see what your risk is. The other thing you could do is to do a risk calculation. Now, there's lots of these available. I've just highlighted one here that is very accessible for you to do. It's on a website where if you need to, you can translate into a language that you understand if English is not your first language. It's likely to ask you things like your age, your ethnicity, is there a family history of diabetes, and also do you have other conditions, as well as some other questions, and that will give you a calculated risk. So it's not a number as such, it's low, medium or high risk of developing type 2 diabetes over the next few years. And you can get some information that you can take to your healthcare provider to say, I'm at low, medium or high risk. And it also gives you some advice about what you could possibly do. Now, I spoke about carbohydrates at the beginning because carbohydrates are the main food group that will have the major effect on blood glucose, depending on how they're cooked and what else you eat with them. So what could you do? Um, who doesn't love the yam or the potato or the pasta or the bread? So if you want to, perhaps what you could do is work on your portion size, because as you can see from this diagram taken from our book, the smaller the portion size, the lower the effect on your blood glucose. So what else could you do? Perhaps you could keep your carbohydrates to the carbohydrates that grow above the ground, so the vegetables that grow above the ground, because they tend to be lower in carbohydrate content than the root vegetables, the ones that grow below the ground. You could also on your plate try and keep your carbohydrate content to the palm of your hand. Keep it to that size and try not to have it higher than that. So there's just a couple of tips about things that you could do. So just to recap, what could you do now? You could check your risk. Remember, I gave you the risk assessment tool, which is online, so you could do that. You could check your waist circumference to see what your risk is of developing type 2 diabetes if you're not living with that condition at the moment. And whether you're at risk or whether you are living with the condition, there are certainly other things that you can do. You could make some lifestyle changes. So is your weight or your waist circumference at the healthy range? Is it where it should be? Could you perhaps do something about it? Do you need to make any changes to your eating pattern? I spoke about carbohydrates, but there's other things that you could do to perhaps make your eating healthier. And could you be more active? Because ideally, we're aiming for about 150 minutes of activity per week. Sounds like a lot, but it doesn't have to be. It could be in 5 or 10 minute chunks. It can be anything from going up and down the stairs to getting off the bus, a stop earlier, to going to an outdoor gym, to going to an indoor gym. So there's lots and lots of possibilities. Dancing is something that I know people love. I like that as well. So, and then the other thing I would say to you is each one teach one. So if there's something that you've learned from here, then please go and share that with somebody else, because you might be doing something to make that person have a healthier lifestyle. So each one teach one. I really hope that that's been helpful, and I thank you for your attention. If you want to see the fuller series of events, it's available on the Abalone Trust website. Take good care and wishing you good health. Thank you.